Medigap plans are a great way to supplement your original Medicare coverage. Now, original Medicare does provide truly comprehensive coverage, but there are some gaps, and Medicare Supplement Plans are a great way to fill those gaps. However, not all plans are created equally. So in today's video, we're going to go over which Medicare Supplement Plans you may wish to avoid. Now, before we dive into today's video, please do make sure to subscribe to stay up to date. And of course, make sure to click that thumbs up button, give us a like so we can get this information out there. And if you'd like, you can even ring the bell for notifications. Now, if you have any questions whatsoever, please feel free to give us a call at the number on the screen. And of course, you can reach us in the comments as well, and we are more than happy to help. When you turn 65, you'll become eligible for Original Medicare. Part A is your hospital insurance, and Part B is your outpatient insurance, and together they will cover most of your health care needs. Medicare.gov is a great resource to learn more about Medicare, and specifically it can go into further detail regarding the benefits covered by Medicare Part A and Medicare Part B. So let's take a look.
This page on Medicare.gov details exactly what Part A covers. Remember, Part A is your hospital insurance. So, of course, it will cover inpatient care in a hospital. So if you need to have surgery or any type of treatment that requires a hospital stay. It will also cover skilled nursing facility care or nursing home care. Now, these are not to be confused with custodial or long-term care. These type of care facilities are really just for recovery or rehabilitation after a hospital stay. So you need to require some type of skilled nursing or medical treatment in the skilled nursing facility care or nursing home care. It'll also cover hospice care and home health care. Then if you scroll up, you can click over here to see what Part B covers. Now, Part B is your outpatient insurance. This is the insurance that you're probably going to be using most often. So it will cover your basic wellness and preventative services, any medically necessary services, and then, of course, it'll cover things like clinical research, ambulance services, durable medical equipment, so that would be like wheelchairs or walkers. It'll also cover mental health and very limited prescription drugs. So these are not going to be likely the drugs that you might take on a regular basis for cholesterol or high blood pressure. It would be more things like chemotherapy or vaccinations, that type of thing. It'll also cover insulin if it's administered via pump. So that's very important. If it's not insulin that's administered via pump, then you would need a Part D plan.
Now, although Original Medicare is great coverage, there are definitely gaps. Now, the first type of gaps are benefits that are just not covered by Original Medicare. These would be things like dental, vision, hearing, and prescription drug coverage. So for this type of coverage, you're going to need additional insurance. There are Medicare solutions as well as non-Medicare solutions. But Medicare Supplement Plans will really cover the financial gaps, and that's what we're going to be talking about today. So these would be deductibles, co-pays and co-insurance, and out-of-pocket maximums. And then, of course, there are the premiums to keep your Original Medicare active. Now, many people are surprised to find out that they have to pay for Medicare at all. But yes, at the very least, you do have to pay for Medicare Part B, although most people are eligible for free Medicare Part A based on theirs or their spouse's work history. So let's start by addressing some of these gaps that Medigap plans can cover before we get to the plans. So the first gap, of course, is the deductible. The deductible is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share. And there is a deductible for Part A and a deductible for Part B. The Part A deductible can be a little bit confusing to understand because it is not a once annual deductible as you've probably had in the past. It is applied per benefit period, and that term can be a little bit confusing. But you can think of it like a hospital stay. Basically, let's say you have to be hospitalized for a surgery at the beginning of the year. Well, first you would need to meet your Part A deductible before the cost share takes over. And let's say later in the year you have to be hospitalized again. Well, once again you would have to meet that deductible because this is a new benefit period. We delve a little bit further into that in another video, and I'll make sure to link that in the description below. The Part B deductible is much easier to understand. It is a once yearly deductible, and once you've met that, then your insurance will begin to contribute to the cost share. Now, these deductibles, of course, do change on a yearly basis, but in 2023, the Part A deductible is $1,600, which is up from $1,556 in 2022.
And in 2023, the Part B deductible is $226, which is actually down from $233 in 2022.
Then there are copays and coinsurance. Again, with Part A, it's a little bit more confusing to understand.
So basically, your coinsurance depends upon your length of stay and your type of stay. So for inpatient, which is in a hospital, days 1 through 60, your coinsurance is $0. Now that's after you've met your Part A deductible. So should you stay longer than 60 days, between 61 to 90 days in 2023, it is $400 per day. And should you stay somewhere between 91 to 150 days, then your coinsurance is $800 per day. And of course, after 150 days, you'd pay all costs. It's very unlikely, of course, that you would stay in a hospital this long. It's more likely that you'd be referred to a skilled nursing facility. So again, days 1 through 20, $0. Days 21 through 100 in 2023, it's $200 per day. And should you need to stay longer than that, you would pay all costs. Then there's home health care and hospice care, and that's $0 for covered costs.
Part B is much more straightforward. Generally speaking, it is 20% of the Medicare approved amount. The only exception to this are Medicare Part B excess charges, which we will talk about later in the video. So Medicare Supplement Plans will help to cover these gaps of original Medicare. Additionally, Medicare Supplement Plans can offer an out-of-pocket maximum. But like I said, not all plans are created equally, so let's dive in and take a look at the plans.
So these are the 10 Medicare Supplement Plans, also known as Medigap Plans. Plan A, B, C, D, F, G, K, L, M, and N. And then on the left-hand side, you'll see basically the gaps that they may or may not cover. So Part A, coinsurance and hospital costs up to an additional 365 days. So you'll see that all of the plans will cover that. Then there's Part B, coinsurance and copays. You'll see that all the plans will cover that in some capacity, except plans K and L are known as cost-sharing plans. So Plan K will cover 50% and Plan L will cover 75%, and you'll see that's a continuing pattern. There's blood, the first 3 pints. Part A, hospice care, coinsurance and copays. They're all going to cover that. Then there is skilled nursing facility care coinsurance. So remember, as we just discussed a moment ago, days 0 through 20, there is no copay. But after that, the copays are rather exorbitant. So Plan A and Plan B will not help you with that. The rest of the plans will contribute in some way. The Part A deductible. So remember, that is per benefit period. Now, all the plans except for Plan A will help you in some capacity. The Part B deductible. And actually, no plans that are offered to new enrollees will cover the Part B deductible, so really you can just ignore that entirely. Then there's Part B excess charges. I did mention earlier that we would get back to that. So any doctor who works with Medicare must accept the amount that Medicare is willing to pay out. However, they can choose to charge up to 15% more than the Medicare approved amount. And if that is the case, if your plan does not cover Part B excess charges, you would have to pay that additional amount. For example, the Mayo Clinic is very well known for charging those Part B excess charges. Now, the only plan that is offered to new enrollees that will cover Part B excess charges is Plan G. Really, the main difference between Plan G and Plan N is that Plan G will cover Part B excess charges and Plan N will not. Then there's foreign travel exchange. You can see here that many of the plans will cover about 80%. And then there's this out-of-pocket limit. So Plan G will basically cover everything. Plan N will basically cover everything. Plan F would cover everything. Plans K and Plan L are cost-sharing plans, so they will impose an out-of-pocket maximum to help you from incurring major medical debt.
So we're going to start with Plan A and Plan B. I'm going to lump them together because there are similar issues with both plans. Let's take a look at what they offer versus what they may cost.
So the biggest problems with Plan A and Plan B are the skilled nursing facility care coinsurance, because that can really stack up. For example, let's say you needed to recover from something as common as a knee surgery. Well, it's recommended that you rest and basically don't resume normal activity for at least 6 weeks. And let's say that you didn't really have anyone to assist you at home and you needed to stay in a skilled nursing facility care for 6 weeks. Well, as we talked about earlier, there is no copay for days 1 through 20. So that's basically the first 3 weeks. But you would have an additional 3 weeks of $200 per day. That's $4,200. Now that's just one example, and that is also not taking into consideration that for Plan A, your inpatient deductible would also not be covered. So that is an additional $1,600 on top of that. So you can see there's certainly a significant amount of risk with Plan A and Plan B, and the whole point of a Medigap plan is to mitigate that risk. Now, if you were to look at the prices and compare that to other plans, you would see that this is probably not the best bang for your buck. Now remember, prices are determined by your age, your gender, if you possibly need to undergo medical underwriting, and of course, where you live. So please do take this with a grain of salt. But you can see here that Plan A, at least with the information that I've put in, ranges between $172 to $434. Plan B could range from $227 to $334. Again, you will likely be looking at different prices. But let's compare that to some of the other plans. For example, let's compare that to Plan G. And it is not that different for a plan that is going to offer you significantly more.
Now let's talk about Plan F and Plan G, but specifically the high deductible versions of Plan F and Plan G. Again, I'm going to lump them together because there are very similar issues with both of these plans. So let's take a look at what those issues might be.
Now, there's no denying that Plan F and Plan G offer you truly comprehensive coverage. They are the most comprehensive coverage options available, although more on Plan F in just a moment. So Plan F and Plan G may seem like a great option, and perhaps they are, but let's talk about these high deductible versions, because those deductibles are quite high. So you'll see down here, Plans F and G also offer a high deductible plan in some states. So let's take a look at these high deductible health plans. So you'll see here that the deductible is $2,490. And for the high deductible Plan G, it's also $2,490. So yes, these plans are less expensive, but you have to meet so much out of pocket before your Medicare Supplement plan will actually begin to contribute that it almost doesn't seem worth it. These plans are going to offer the same benefits as Plan G and Plan F. So although you might be paying more on a monthly basis, you're going to get more bang for your buck, most likely, if you were to do the regular versions of these plans.
Finally, let's talk about Plan F in general. Now, Plan F is actually a great plan. Until recently, it was really the most comprehensive coverage offered. However, one of the main problems is that it's no longer being offered. Plan F is no longer being offered to new enrollees. However, even if you were eligible for Plan F, there are still other issues. For example, when you compare Plan F to Plan G, they're almost exactly the same. The only difference is the Part B deductible. However, on average, Plan F tends to be much more expensive than Plan G, so you're really not getting the best bang for your buck. Additionally, although most Medicare supplement plans, if not all Medicare supplement plans, do tend to increase on a yearly basis to account for inflation and rising healthcare costs, Plan F historically has risen at a more drastic rate than other plans, so not our number one recommendation. But if you're wondering what is our number one recommendation, well, it would either have to be Plan G or Plan N. Those are two of the most popular Medicare supplement plans, and for good reason. Now, if you'd like to learn more about Plan G and Plan N, do make sure to check out one of our other videos, which I will put in the description below. Of course, if you have any more specific questions, feel free to give us a call at the number on the screen. And of course, you can always reach us in the comments, and there is no charge for our services. We are more than happy to help answer any and all of your questions. Now, if you liked today's video, do make sure to subscribe because we release these videos on a weekly basis. There are constantly changes in Medicare. We want to keep our viewers informed. And of course, make sure to click that like button so we can get this information out there. Thank you so much for watching, and you have a wonderful day. Bye-bye.